Afternoon, but it's good morning. As we were asked to move up to do this presser this time of the day. So I'm pleased to be joined by Dr. Kieran Moore, Ontario's next Chief Medical Officer of Health. And I'm very pleased that we'll have a comment in that and have him speak later on in the press conference here. This is my last press conference, and we are trying to get the total number that we've done. I haven't got that number exactly, but it's been a journey. I'll comment on that at the end. So besides the regular update, and because it is Thursday, how have we done this week? And then handing things over officially to Dr. Moore at the end, and then answering questions. So how have we done this week? Because we're watching the data carefully. It's going in the right direction. At the same time, internationally, we're hearing a number of other jurisdictions that are starting to see struggles as they deal with the Delta variant in their respective jurisdictions. So since Monday, we've had 847 cases of COVID-19. It's been a long time since we've had under 1,000 cases in that time period. And that tells you the impact we're having with the vaccination program. But what does that consist of? We had 296 cases on Tuesday, but that was a data cleansing error. There was 80 of those were from previous, so that put it down in the low 200s. On Wednesday, we had 255 cases, but today we're up to 296 cases. That means our 7-day average continues a steady decline and is currently 305, down from 443 1 week ago. So we are watching these numbers. We're into the end of the week when we have larger volumes. I'll comment on that in a moment, and to see will we stay under 300 and will we progress down further over the weekend. Today there are 284 people in the hospital and 299 in the ICU. 10 of those are from Manitoba, which means we're at 289. This is a success that we were looking for as we consider moving into step 2 and then beyond. And so we want to make sure that we are continually making the way for the hospitals to recover and to move assertively towards resuming elective surgery and dealing with the backlog therein. Sadly, we're still experiencing deaths, and we had an additional 77 deaths since Thursday's update. And you're going to see as it goes on, these are a late measure, and these deaths, even though our numbers come down, they will unfortunately accrue. And this is where we want to express our sympathies to the families and we would like to see these ones really reduced extensively in the weeks ahead, especially because we've seen the major success with the vaccinations in preventing severe consequences, hospitalizations, and deaths. And so we have a sense and we have a strong feeling that these can be preventable. In terms of testing, we did 29,514 tests yesterday, getting close to 30,000. But the positivity rate came down to 1.1%. That's the lowest we've seen since the end of September. That's a while ago. And the positivity rates continue to decline week over week. So our daily 7-day average was 1.6%, down from 2.1% 1 week ago. And we've been seeing this steady drop in the rate and positivity, and that is encouraging in that. Why? Well, that's vaccines. And that has been a tremendous success in the last few days. We've seen record numbers being undertaken in one day. To date, we have more than 13.3 million doses of COVID-19 vaccine have been administered. That translates to 76% of adults who've had 1 dose of the COVID-19 vaccine and over 29% with 2 doses of the vaccine. And we're seeing movement in all age groups, especially in our youth as well. We would like to get that 76% up to 80 and beyond. And so we're encouraging those who have not been done that they would consider contact your primary care physician, your pharmacist. If you have any concerns and issues, deal with those openly and get your questions answered, because we want you protected, especially because we still have the Delta moving through, and our vaccine, especially the 2-dose, is highly effective against the variant. So by getting your vaccine, you protect yourself and those around you. And as vaccination increases, the community becomes safer. And what is most important is that you complete the series. So you need to get the 2 doses. And we have told you it's okay to mix. One time you get Pfizer and then another Moderna, because at this moment our major supply has really picked up with the Moderna vaccine. And we have millions of doses coming, and we know that we will have, and we have moved up people's second date earlier and earlier. And that is exciting and an important achievement in our program. And I know I've been taking a number of our different MOHs have been promoting. I know Dr. Lowe said recently in Peel that whether you're getting your first or second dose, remember that mRNA is mRNA. And that is what you're being offered. And the technology is quite similar. So, what does that mean? So in concluding, we have new milestones and trends. We have set 2 records in daily maximum vaccination, over 217,000 doses in the last 2 days each day. That is well done. So what does that mean? That means we have are going to be announcing, we have announced that as of today we're announcing that we're going to step 2, slightly earlier than originally timelined. Instead of after Canada Day, it's before Canada Day. So midnight, 12:01 on the 30th of June, the province will be moving into step 2. That's to your credit. That's for the vaccine. That's what you've done when you turned out. What does that mean? In a synopsis, people are very excited to be able to get haircuts again. You can visit outdoor amusement parks and water parks. For the first time in a long time, you can gather indoors with up to 5 people, not necessarily from your household. I know that these are great rewards for you in Ontario who have made this time, and we're taking it slowly and cautiously going forward, so that we want to say thank you for what you have done. Stay the course. We want to see how we do over the next while. Other jurisdictions have seen some upsurges in the variant. We have seen some in some parts of Ontario, and we're continuing to monitor that as we keep you informed. Now, Dr. Moore is very determined to keep on top of that, and with very much vigilance in case contact management to see if we can contain these outbursts, if you may say, in our populations where we have under-vaccinated or unfortunately unvaccinated clusters of people. So we are making steady progress. And I think that's why at this time, as I do my last press conference here, and it has been a journey. We have gone through many things together. We've gone through good moments and some challenging moments. And as we got through almost like a ship on the ocean, as we rise over one wave and come down, we hit another wave, and sometimes we're not sure if the bow is going to clear the next one, we come out again. And that's because of a lot of effort and energy by everybody in the government, our teams, Public Health Ontario, our agencies, our science advisors and experts, the stalwart work of all the vaccinators, and that's a huge effort. The case contact management that's been undertaken day after day, week after week by our public health officials and our central case contact management team to keep those contained, and that's going to be critical in the weeks ahead. If we look at the testing alone, it becomes almost like routine for us, but the fact that we've gone through and done over 15 to 16 million tests, those are not just people handing off samples, those are nasopharyngeal swabs done carefully and sensitively to the patients. You coming in, recording the data, getting it accurate, sending those results in, getting the laboratory tests processed in a very short order, huge hours put in by technicians. The data going back, the follow-up with the clients, and our percent of results wasted or lost, less than 1%. That is a huge achievement over a year and a half. And sometimes we forget about that. We forget about this work that's kept you informed, it kept us informed, and they've done an amazing job. And that's why I've been so rewarded to work with such a massive team, with Deputy Helen Angus, with Minister and Deputy Premier Christine Elliott, with Premier Ford and the Cabinet team in there, and with our Secretary of Cabinet, all the way through with many Deputy Ministers. It has been a full force effort in our government, never seen before. And to be able to give advice and leadership in that way has been a privilege. And to serve you, the people of Ontario, over the last 18 months, and before that as the Chief Medical Officer of Health, during less tumultuous times. So that's why I'm pleased to be able to say it was important to me to have a successor to hand over to. And Dr. Moore is one of our local medical officers of health who is well experienced in dealing with public health, trained fully and qualified in public health, and I know has the abilities in that with the team backing, and we've built up a huge team, a great team to give support, to support him, to support you as you go through this next phase, as we are not out of it totally yet. We're in a good moment coming down, but there's more work ahead. And I know he'll make some comments on that in a moment. So I would endeavor to ask everyone to give full support to Dr. Moore. And because he not only speaks for himself, he speaks for our big team of all our public health servants, both in the local health units, centrally, our agencies, everyone who have put in huge hours, week after week, sacrificing family time, sometimes into way hours of the morning, sometimes through almost periods of exhaustion and tears, and they have done a fantastic job that has served the people of Ontario in that way. So this is not a Lone Star job. This is one that I have the privilege of working with a tremendous amount of great people, and also with you, the people of Ontario. So I'm incredibly pleased at this time that you'll have a capable, passionate, and committed public health professional system to go to, and I look forward to that. And I'm really pleased to be able to have this time to hand over to Dr. Moore. And with that, I'm going to say thank you, and now over to you, Dr. Moore, for some comments from your side. So welcome, sir.
Thank you very much, Dr. Williams. I personally want to thank you for your service to Ontario. We all owe you a significant debt of gratitude. Thank you for your guidance and leadership. I very much appreciated the last 3 weeks working with you and learning the systems that are in play at a provincial level. They've been very insightful, and I feel more comfortable now, even with the short 3-week time period of overlap. What you have taught me and guided me through will help with the strong foundation going forward. I also want to thank you. You've worked tirelessly to guide Ontario through this pandemic, have shouldered a heavy responsibility and load, and done so with integrity and compassion. I only hope I can continue that level of dedication to Ontario. Certainly your retirement is well deserved. I personally will miss you very much, and I look forward to working with the incredible team that you've gathered together. We have a lot of work still to do to continue to respond to this pandemic, to continue to build for our recovery plan, and to restore the basic health and public health functions that are required as we get back to a post-pandemic period. I want to thank you, and I also want to thank all Ontarians that have gone through this very difficult year and a half, and for the resilience you've shown. We know that we need to recover our social, mental, and physical well-being over the next several months, and moving to this next step will hopefully get us on the right path. It's an honor to serve Ontarians going forward as the next Chief Medical Officer of Health, but I look forward that it's not just one individual, it's a team across all of Ontario, starting with your local public health agencies, building to Public Health Ontario, the ministry, and the health system. And we have worked collaboratively well together over the last year and a half, and I want to continue that fine collaboration, coordination, and communication that you've helped develop. And again, just on a personal level, thank you, thank you, thank you.
Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Rob Ferguson from the Toronto Star. Rob, please go ahead.
Hi, doctors. I'm not sure who's going to want to field this, but I want to wish Dr. Williams all the best for his retirement, and welcome Dr. Moore. What would the guidance be for example, if you're having people over to your house, or and some are vaccinated and some are not vaccinated? Do you have any guidance on that?
So, Rob, thank you, and thank you for this journey we've done together with you for a year and a half and beyond that. We have our team looking at what does vaccination mean as we approach beyond 20%, heading up to 30%, and getting beyond 25% of our population. What does it mean for you individually, and what does it mean for a population immunity or community immunity, if you may? And we're hoping to have some guidance documents out on that fairly soon. Because there's some aspect that as you have control on situations and you understand, there may be more latitude of what one might be able to do in that type of setting that you were alluding to in your question. So I know the team has been working at that. We've had discussions. We hope to have something out fairly soon to be able to update on if you are fully vaccinated. That means 2 doses of a acceptable and approved vaccine, and at least the 2 weeks, preferably 3, post-vaccination so that you've amounted a adequate level of immunity, noting that there's a range, of course, of variety, younger ones sooner and older people a bit longer. So stay tuned and we'll have that out for you because I know people are eagerly waiting to hear some direction in that regard.
Follow-up?
All right, thank you. And just to clarify one thing before, if I can sneak one in, with up to 5 people in the house, is that 5 people in addition to the people you already live with? And I wanted to ask about masking at public venues and fairs and things. Are people supposed to still mask at all these things?
Well, Rob, you're trying to capture everything that's on the table to discuss. And the point you're raising, you're going to have your household in your place without masking. Of course, you've been doing that all along. And if you're asking if you have 5 other people who are not part of your household, does that count or not? These are the actual questions you have to go through down to that type of granularity. And we're hoping to have some details on that. As you got down to asking other venues, you can see the myriad of different settings and components that are embraced within, embedded, I should say, within the step now. So what does it mean in step 2? What does it mean in step 3? And of course, then what is beyond step 3? And these are other tasks and work that is ahead for Dr. Moore and the team, along with our public health measures table and other experts. And we hope to get that out. I hope he hopes to get that out in the next week or so, because I know public are asking. Now we've gone to get our 2 doses, and we're now going past a week to 2 weeks to 3 weeks. What does it mean in that matter for me personally, for a household, and for some activities in there? So we want our Ontario version of that. We no doubt you're listening and watching what other sectors are saying, and so there's a lot of need to sort of merge that with what other parts of the country are doing. And then also you have some of the aspects that are people asking in relation to federal authority with what does it mean with travel in and out of the province. And these are things that are moving on all sectors, and so we hope to coordinate that to, if best as possible, to be clear on that and without confusing public, because it's a lot of things moving at the same time. So again, as I used to say before, stay tuned, and thank you for leading those questions, Rob.
Next question.
Your next question comes from Laura Stone from the Globe and Mail. Laura, please go ahead.
Hi, Dr. Williams and Dr. Moore. Can you explain why, since Ontario has blown past its Step 3 vaccination rates, that we're only just entering Step 2 and are likely to stay here for around approximately 21 days, according to the press release? How do you explain that to people who've gone out and done their duty, who've followed the restrictions, who've gotten their vaccinations, and are now kind of stuck waiting while the government has blown past its own markers?
Well, thank you, Laura. And remember, the vaccination markers are one of the metrics. It's one of the minimal things we have to achieve. And while we might say we've blown past, those we just got past the 20%, most of them have got that in the last week and a half. So they have another week and a half to build up immunity till they're ready to go. And we know that they're immune, not just vaccinated in that point. There's other metrics we're looking at as well. And as you see, our numbers today hedged up close to 300, maybe over 300. We're having outbursts, more cases in the Kitchener-Waterloo area. Porcupine Health Unit seems to be settling at this time, we hope. There's some others that are showing some concerning trends. Because still with that 74.9 or 75 first dose, that's 25, 1 in 4 people are not vaccinated with 1 dose in the province of Ontario. That's a significant number of people that can, especially if they're clustered together, can cause outbreaks. And we've heard reports in Europe that they're seeing upsurges in Delta and in the U.S. in some parts. So we can't be too casual. We have to watch how this handles and how when we open up these new venues and behavior, everybody's still being cautious that we're going to step 2. It doesn't mean throw everything off. You still have to be careful, and you still have to watch what you're doing, because some of your members of family are not vaccinated yet, and you want to protect them and protect others. So while everybody is in a rush to open up, we don't want to go out and back down again. Opening and closing is very disturbing to people. And so I think while everybody's in a hurry, we'd rather be taking slow strides forward than trip going out the door, if you may. So be patient. We did move up our time by a few days with step 2. Let's experience step 2. Let's watch how the immunity keeps building up. I'd like to push back 30% up to 40% if we could. I'd like that one dose getting up to 80%, and if not, beyond. So we have a lot of work ahead of us. Again, step 2, I think, is award and a positive reinforcement for the people of Ontario. You've earned it. You've done it. But let's keep it. Let's not step back again, and we move stalwartly forward, hopefully, in a while, to step 3. Did you want to make a comment, Dr. Moore? Go ahead.
Yeah, a very good question, Laura, and thanks for it. The other issue we're following is the Delta variant that's in Ontario now. It's roughly at 50% of the strains that have been identified. And we're seeing that it's spreading rapidly in certain areas of Ontario now, including the Waterloo region. And we're working very closely with the Medical Officer of Health, Dr. Wang, in the Waterloo region. We've followed also what's going on in England, and as Dr. Williams said, in other areas of the globe, where even despite high immunization rates, they're having resurgence of activity. And that's one of the last things we want to see happen in Ontario. So I do believe a slow and cautious approach is warranted, with Delta becoming a major strain in Ontario. We're also learning that one dose of vaccine is somewhat protective against the Delta strain, but 2 doses is highly protective. And so we'd love to see the percentage of our Ontarians with their second doses rising even higher. And again, have to thank Ontarians. 76.7% first doses, 29.1% second doses, and it is an amazing record. And we thank everyone that's come forward to get immunized. But to open up in the face of Delta, we would really like to see a higher proportion of, especially those that are elderly and vulnerable to this virus, immunized with their second doses. And as Dr. Williams said, yes, we're watching that data very closely, but also hospitalizations. We're watching Waterloo and Porcupine and North Bay and now Grey Bruce and activity levels in those regions. Very happy to see the rates going down in Toronto and Peel and York. That's been brilliant and hard work, and their immunization teams are working diligently as well. So we're watching all of this data, and I absolutely agree with Dr. Williams, slow and steady, cautious in the face of Delta. We don't ever want to have to go back, only moving forward for Ontario.
Follow up?
Thank you both for those responses. So the government's plan for step 3 goes to as high as about 80% for first doses. So I know that you keep saying, Dr. Williams, that you want to get more people to get their first doses and concern that 1 in 4 people haven't. But at what point do you just accept that not everyone is going to get vaccinated? And at what point is it satisfactory for the government that, say, 80% of people will get first doses, and that's the highest that you'll reach? What is your marker for that?
So you're asking if the task force is, when are they going to throw in the towel? They're not going to throw in the towel. They want to get that 80%. We've had some of our people out there, some of our experts saying, why are you only going for 80? Why don't you go for 85 and 90%? And I think it's a matter of how to find those individuals. Working, I think, even more with our various pop-up clinics, we're finding they're still highly effective. And you come into areas where people say, well, we didn't get out, transportation was difficult, we weren't sure, and it wasn't in a setting we're comfortable with, and all of a sudden you get 300 or 400 people coming out. And so we want to make sure that we're not giving up on those people who are still willing and wanting, and how to make it acceptable and reasonable to get it. So I don't think we've exhausted all our channels yet, and we still want to keep pushing ahead on that. And Dr. Moore, and again, some more comments, and that's what I want to hear.
I'm very pleased with what Ontarians have achieved so far with 76.7%. The second doses are rapidly increasing, which is also brilliant protection for Ontario. We're monitoring this data on a regular basis around the clock. I get reports almost every hour on the immunization uptake and have to thank Ontarians. This is a brilliant track record. We are making terrific progress in protecting our community and moving from a pandemic to an endemic state where we can try to get back to normal. And thank all Ontarians for this great work. We're modeling up to 80%, and I'm very happy what the modeling is showing us to be able to achieve 80% in Ontario for first and second doses. I'm not going to give anything away just yet, but it's looking very promising. The Ontarians are coming forward. Our mass immunization capacity is building day in and day out. Our numbers of vaccinated per day in Ontario will be increasing, and now we're reaching out to our primary care partners, our pharmacy partners, to be able to do that last additional 10% to speak to those that may be hesitant, to address their questions, to ensure that those questions are answered, that they have confidence in the safety and effectiveness of the vaccine supply in Ontario, and realize the benefits of building community immunity. Once we achieve that 80-80, the incidence of even Delta will be going down in our communities, and we'll be able to open up more fully and more safely very quickly. So if you're hearing the tone of my voice, it's very positive. It's very thankful to all Ontarians who are embracing immunization as a means of protecting themselves, their families, their communities, their workplaces, and protecting the health system, because I think we all realize we want our hardworking intensive care nurses, respiratory therapists, emerge nurses, paramedics to not have to deal with such difficult cases, and also be able to continue to do the fine work they do on all the other health system issues that they deal with on a day in, day out basis. And I'm sure families would be appreciative of a decreased risk in their neighborhoods. So it is heading in the right direction. The glass is half full, and we will open up more safely down the road.
Next question.
Your next question comes from Matthew Bingley from Global News. Matthew, please go ahead.
Hi, doctors. I'm wondering, where you have one outgoing and one incoming Chief Medical Officer of Health, I'm wondering how much collaboration there was on this decision in providing advice to Premier Ford, and did you both reach consensus with what was actually recommended?
I think if I understand, in the decision to go to step 2, I believe, and all the way along, while it's still under my position as the Chief Medical Officer of Health, as Dr. Moore has alluded to over the last 2 or 3 weeks, I have endeavored to say, I'm doing this because it overlaps with your time. What do you think? And what do you want? And that's part of what I do. I've done a number of succession training things with individuals, and it's not a dump off, it's a clean handover and giving responsibility and decision making, which I am very happy to hear in all the comments. I'm saying this is music to my ears and all that kind of process here in that, and we would have liked to have more time, but even if the decision step 2, I made sure it was consistent with what Dr. Moore felt as well before I went forward, because I want to make sure that is like a tandem, and then handoff is a smooth process, because the ramifications follow up what it means in the weeks ahead.
Yeah, on my behalf, I can't thank Dr. Williams enough. He's been a terrific mentor over the last 3 weeks. In the first week, it was 12 hours a day at his hip, working in his office with our masks on. And the second week, we were making decisions together. Third week, he was helping me make decisions going forward, anticipating that I will be the one, together with our team, responding to the decisions. So that was the basic transition. Very collaborative, very coordinated, and I can't thank him enough for his mentorship over the years that I've known him, but also over the last 3 weeks.
Follow up?
Yeah, Dr. Moore, I'm wondering, when it comes to the Delta concerns, and you just mentioned that you feel like we're going into an endemic state. Based off of what Dr. Williams was saying with case and contact management, do you think that the resources are there to be able to catch these variants as they come in, or would you like to see more resources put to that effort?
So great question. We're preparing for an endemic state by having our health units starting to tabletop and build capacity for case and contact management, for ongoing testing capacity throughout the next year, as well as restoring all their basic public health functions and health system functions. So we must, over the next year, maintain a case and contact management capacity that's robust, that can put out any fires that start, as well as having a testing strategy that can identify the next strain that's circulating. It's very important that all Canadians realize it's only 10% of the globe that's going to have access to vaccines as we speak. And we're so fortunate in Ontario and Canada to be leaders in being immunized. But 90% of the globe is not immunized, and that's where the virus continues to circulate, where mutations will develop, and any returning traveler could bring the virus back into Canada at any given time. So we need a very robust federal testing strategy, isolation and quarantine strategy, and we're very much looking forward to working with our federal government to strengthen that, because that's the only way the virus can come back into us once we have a low endemic rate. And to me, that's where we really have to focus our energies going forward, is testing aggressively for returning travelers, identifying when they have a new variant or are positive for COVID, isolating them so that they don't bring it back into our communities. And obviously, we're looking for any strains that would be escape from the vaccine, so the vaccine wouldn't be as effective. That would be a very serious situation for us, and we will maintain capacity over the next year to ensure that we can identify them, have aggressive case and contact management to prevent the spread within any community, and have a very robust testing strategy, including whole genome sequencing, and that will be maintained. We'll work over the tabletopping of this throughout the summer, and then also prepare for outbreaks within congregate settings, whether they be in schools, colleges, universities, corrections facilities, long-term care, or retirement homes. We're doing all that due diligence to prepare for this new endemic period that we'll see starting in the fall as Ontarians go forward to get the highest immunization rates in the world.
Last question.
Your last question comes from Lorenda Redekop from CBC News. Lorenda, please go ahead.
Hi there, doctors. What is your advice to parents who may be wondering about vaccinations for children, given this handful of cases of myocarditis, when we've also got, the CDC does say it's okay to vaccinate children. The WHO is still not recommending it. What do you say to parents?
So it's very important that parents understand we have a very good safety system in Canada. We're monitoring this situation very closely. We monitor for any adverse events following immunization, collect that data at a local public health agency level, aggregate it and analyze it at a provincial level, and then share it federally. At present, we're not seeing any significant signal from the mRNA vaccines with the association of inflammation of the heart muscle or the sac that's around the heart, so myocarditis or pericarditis. And we're learning from the American experience. We've just received their documents yesterday that review that the risk of myocarditis and pericarditis is very small, and the benefits of the vaccines in preventing hospitalizations, the use of intensive care settings, and the long haul syndrome of COVID in children, the immunizations can prevent all of that. So the risk to the benefit of being immunized is significantly towards the benefit. And we're also awaiting the National Advisory Committee on Immunizations review of myocarditis, pericarditis associated with the mRNA vaccines, which should be coming to us next week. And we'll review that and make any other additional information available to parents. We've had great partnership with the Hospital for Sick Children, as well as other pediatric specialists who have informed us of these risks and helped us with communication pieces for the public. But in our opinion, and we're waiting for NACI on review of the American information, the benefit of the vaccine far outweighs the risk of myocarditis or pericarditis at present. But you should all be assured that we're monitoring this data very closely. We've got a great adverse event following immunization safety net to monitor for it, and we'll continue to do so over the coming months.
Follow up, and this is the last question.
Given where we are at currently for the vaccination metrics, and we will be there for 2 weeks already, before, I know there's a lot of dates I'm talking about here, but, before 3 weeks more are up from entering stage 2. So what do you envision in terms of when we could safely move to step 3? And Dr. Moore, I understand you also speak French. I've got a little note from one of my French colleagues asking if we could have this in both languages.
Okay, en français, je vais suivre un cours de français pendant les
I'm going
prochaines
to
semaines.
take a French
Et moi,
a course in the next few
après
weeks.
cette, instruction,
After
je
this
saurai plus
conference,
répondre en français
I'll
mieux
be
que
able
maintenant.
to
Alors,
convey
je vais
the
parler
information
seulement
in
en
French.
anglais aujourd'hui.
Today
Je
I'll
vais
speak English,
améliorer mon
but
français
I
jour
will
après
work on
jour,
my
j'espère.
French, and
D'accord,
I hope
so
I'll
your
be
question
able to
was in
speak French very
English
soon.
was-
The rates and
Basically, what do you envision in terms of just how soon we could safely move to step 3, given where we're at right now, and that shortly we will be already reaching 2 weeks of those vaccination metrics for step 3?
As Dr. Williams said, we have to really go slow and steady in the face of the Delta strain becoming a dominant strain within Ontario. We're going to be watching very closely what's going on in Waterloo to ensure that it doesn't spread in the southwest region. We're also watching Porcupine, North Bay, and Grey Bruce. What will get us through this is increasing our immunization rate. So I have to thank all Ontarians that are coming forward to get immunized. That is our prevention strategy against all of the strains that are circulating in Ontario at present. And we will be data-driven in our decision-making and recommendations to government. We will follow not just the immunization rate, but the impact on the hospital sector, the admissions to the intensive care unit, and in those that are requiring intubation and ventilation. Those are key metrics that we'll be monitoring, as well as the progress of Delta within Ontario. I absolutely hope that our local public health agencies, in partnership with the ministry, can get the Delta activity under control. That is slowly increasing in some jurisdictions in Ontario. If we can, I can see that as giving the green light to moving to step 3 and progressing back to the post-pandemic era, which we all want to get to.
Thanks, everyone.
thank you.